Hi, my name is Tina Drews, and my husband Terry, and my oldest daughter Pam, and we're a family that have been diagnosed with hereditary hemorrhagic telangiectasis. It's been a really long journey. It kind of started back when Terry and I first got married back in 1974. Shortly after we were married, they felt he had leukemia because his blood count was down like in about 60. And so they ran a lot of tests. No, he didn't have cancer, so they had no idea why he had such a low blood count. Basically, fast forward to mid-1990s. Anyway, Terry started getting these some quite severe nosebleeds off and on, and there never was a rhyme or reason why they would happen. I started doing a little bit of research into why he was having these nosebleeds. So we were going to lots of ENT specialists in Saskatoon, and they basically just felt that Terry was just more prone to nosebleeds than anything else. I actually started writing some letters and got a letter back I had written to the Rare Disease Foundation in the States, and a lady from Yale University at New Haven in Connecticut contacted me, and she felt that from what I had written in the letter that Terry had HHT.
What HHT is our capillary short out. So this can affect many parts of a person's body. Mainly you get really bad nosebleeds, but it can affect your lungs, your liver, your brain, your GI tract, and unfortunately there's no cure. So a person can easily bleed out.
Or have a stroke.
Yeah. And especially with my dad, he'll lose blood. He'll lose an ice cream pail of blood in 10 minutes. So the ramifications of someone bleeding like that is you need to have steps A, B, C, D, and they need to be planned and advanced basically from what the hospital protocol is.
We had lots of ups and downs with the nursing staff and the doctors at the hospital. The one time we had a nurse basically tell us that we needed to not come there, but to basically go to St. Paul's Hospital where all the ENTs were, because they were better dealt to handle with Terry's disorder.
Yeah, we'd walk in, and imagine you walk into a hospital, you have an ice cream pail full of blood, he's bleeding out of his eyes, out of his nose, and throwing up blood. Now, can you imagine what the hospital staff is doing? They had no protocol. So we'd get into the hospital and we didn't know what to do.
No.
And the doctors, they were kind of in a panic because they didn't really know what to do. But the problem with his bleeds back then is it would be every 3 months.
Their main cure at that time when I was going was the ENTs, who were supposed to be the big specialists on stopping these nosebleeds. They tried packing it, but seeing my bleeds were way back in the back of my nose. You can't pinch them off. As a last resort, seeing the packing wasn't doing any good, they were inflating those catheters, those balloons they shoved down my nose. Then the hematologists come up with this new product they had out on the market that a lot of the surgeons use it in the emergency room for stopping bleeds. There for a while, none of the doctors or nurses in the ER had a sniff of how to do this. When I come in there, they'd have to read the instructions, and there were several pages of it. To find which is the right page. Finally, the wife and the daughter, they were able to read the instructions, and being there so many times were able to mix it on their own. So they showed the doctors and the nurses more or less how to mix it. And from there, every time we got in there, if there was a new nurse or new doctor, we'd show them how to mix it.
But it hasn't always been that easy. Trust us. This has been a really long haul.
Yeah, it's been years.
To the care that we have now.
It was bad. And I mean, there was times we came in and they would be doing his blood pressure, and I said to the nurse, you need to take him right now. And no, we got to do blood pressure. I said, you don't have time. And one time he basically passed in the wheelchair. They weren't listening to what I had to say. Like I said, I knew at this point that he needs to be looked at now. We need to get the IVs in and let's get the blood going. But it was just like, well, they knew best.
Yeah. Their protocol against your experience, exactly.
So there was so many trying times.
Back in the day, we just, he would bleed, we'd go into the hospital, and even though they had a care plan for him, great, but no one still knew what to do. So we talked to the nursing coordinator there, and I was like, it's great that we can come to the hospital, but we can't wait 20 minutes, a half an hour for this Surgiflow or Flow Seal, either or, to come. We need to have it ready and waiting for us when we get here. And that's kind of when things started taking rolling, so that we actually got this. We could call before we came, and that's been a massive blessing.
And now the nurses that are in charge there, they really keep good track of that. If they see that there's something that's changed in my care plan, they're up there right away changing it and emailing all the other doctors or nurses that have anything to do with me the updates.
Even though there's great staff and we have this protocol and we can call in, there's still some misdirection between what our hematologist says and say what the hospital says, like especially with your blood. Like his hemoglobin might be in the 80s, but hospital protocol isn't to transfuse until you're in your 70s, kind of thing. So with somebody that bleeds out like him, where do you transfuse? Do you go with what the hematologist says, or do you go with what we think his hemoglobin levels are
and how he feels?
Yeah, and we've actually gotten doctors that while he's bleeding, they don't want to give him blood. I'm a firm believer that nobody ever knows how you feel or what you're going through like you, and you know your body the best. So he knows when he's sick, and if he says I need blood and the doctor's like, we think that he knows best and he needs blood. And sometimes that's a challenge because hospital protocol will say, well, you can't really give him blood, even though he can't talk, he's gray, he's almost passed out. So there's still those fine lines that we've
had to step on a few of the doctor's toes, kind of say, we've had to kind of take charge. And I know I don't like to overstep my boundaries because they are the physicians. But the fact is, this is our family member, and we have been dealing with this for many, many years, and we kind of know where his point is, where he is totally going to pass out with very low blood pressure or end up with a massive heart attack, because he does have AFib, because he does have liver AVMs also on his liver and on his lungs. So, like Pam was just saying, there's that fine line as where do we step in and say to the doctor, okay, I think we really need to. And we've had to do this a few times. Things have improved immensely at Royal University Hospital. I have nothing but awesome things to say about the care that we are receiving there compared to what it was 10, 12 years ago. It was not good. I mean, there was many times we had some bad experiences, but you know what? It was a learning curve for the nurses and the physicians there, and they didn't quite know how to deal with a family that came in where somebody had losing so much blood, and how do we deal with it? Because they weren't had no experience and no education in hereditary hemorrhagic telangiectasis.
It's teamwork, really.
Yeah.
Because,
Yeah, it really is.
Everybody plays a vital role. The doctors are putting in the Surgiflow. I'm mixing one up. Other nurses are putting in the Odanzatron, the tranexamic acid, and if not, then other people are going to get blood or more
getting IVs going.
Yeah, more IVs going.
Yeah.
So now that we have the care plan in place, we have the phone call in place, and they have a step-by-step procedure when we come in. And when we come in, it's organized chaos. So, there's, doctors going one way, nurses going one way, and people are all following the steps of the protocol, in a way that is chaotic, but everybody's getting something done and they're working as a team.
The emergency care coordinator has everybody on board. So all the physicians, all the staff, all know of Terry and know what we're dealing with. Because when we phone in any time of the day, middle of the night, they know we're on our way and they know basically what to do. And that's that education again.
And I think it's good too that when we walk in the door now, it'll be either mom or me that takes them in, and they do listen to us. For the most part, they do. You know, we had an experience the other day. Dad was bleeding, and I could see his blood pressure dropping quite badly, and the doctor was pushing fluids in him, and I was like, okay, he needs blood. Like, he's not talking anymore, he's not responsive, his head is drooping, let's get blood into him now. And I was like, he needs blood now, and the nurses just went and got it without asking the doctor. And at the end, I did feel a little bad because I felt like I had overstepped my boundaries, quite frankly. And I don't ever want to do that, but at the same time, I know the doctor has his best interest, but I really have his best interests at heart. He's my dad, and I want the best for him. So I know that they have a protocol when they give blood, but I know his bleeds, and I know his bleed schedule. I know, his activities and what he's been doing. So I knew where he was standing, and the nurses, thankfully, they agreed with me, and they ran and got 2 units, and they put it in, and that was it, And it's kind of tough though, because I did feel bad because I don't want to overstep my boundaries, and I value the care and everything that we get at the hospital.
Just shows you the compassion and caring that we have gotten, and the nurses too, like really
They're
caring.
phenomenal.
That one time, the one nurse went and bought Terry lunch because he had been in there getting blood, and so she went and bought him some lunch. I mean, that just shows you the compassion of caring. That is really, really come around full circle from way back from the early 2000 to now. So.